Due to the complexity of Miss Bradford's case, I have quite a few PT problems listed. First is impaired functional mobility, including her bed mobility and transfers. This is because of her non-weight bearing status on her right upper and lower extremity, having to wear that TLSO brace when she's upright, as well as only having weight bearing as tolerated in the left upper and lower extremity. And because of all of this, I suspect that she's going to require a high level of assistance initially. My second is that she has severe pain that may limit motion as well as participation in her rehab sessions. She specifically stated that she's trying to reduce her pain and that she's actually afraid of movement because of that pain. So I suspect that that's going to create a major barrier to participation. The third priority PT problem is that she has decreased strength and endurance and overall activity tolerance. So she's been hospitalized for 4 weeks and experiencing severe trauma with an injury severity scale of 51 out of 75. And she's likely experienced significant deconditioning from prolonged hospitalization and immobility. On top of this, her hemoglobin is at 8, which may further contribute to fatigue and decreased tolerance to activity. My fourth PT problem is impaired balance in both sitting and standing, as well as an increased risk of falls because of that. This is because of the non-weight bearing on her entire right side. She has lower extremity fractures, pain, weakness, and she's been immobilized for a prolonged period of time. My fifth PT problem is that she has psychological and cognitive factors affecting recovery. So she has headaches, memory loss, depression, anxiety, irritability, sleep difficulties. Especially the headache and the memory loss is kind of contributing to the idea that she might have a concussion from the accident. These symptoms may influence her participation in therapy and may place her at risk for prolonged recovery, chronic pain, and post-concussion symptoms despite the negative brain CT.